You've seen it in ads, maybe even sitting on your kitchen counter. Fish oil. This golden pill promises heart protection, but is it truly a health hero or just a hype in a gel capsule? Let's break it down with the 4 things you need to know about fish oil. If you're new to the channel, I'm Dr. K from iMedicalSchool. I'm a board-certified internist and gastroenterologist, which is a fancy way of saying I care about your health. Around here, we don't just follow health trends, we ask why they matter. So today, let's talk about fish oil. Since 2002, the American Heart Association has consistently recommended eating 2 servings or 3 grams of fish per week for good heart health. Diets that contain fish have been shown to reduce the risk of congestive heart failure, coronary artery disease, stroke, and even sudden cardiac death. In particular, fatty fish like salmon, tuna, mackerel, and sardines contain high levels of omega-3 fatty acids, which are believed to prevent heart disease. Since the recommendation about eating fish, the supplement fish oil market exploded. Fish oil capsules promise concentrated omega-3 benefits minus the fish breath. But what actually makes fish oil good for you? Fish oil contains omega-3 fatty acids, specifically DHA docosahexaenoic acid and EPA eicosapentaenoic acid. DHA and EPA aren't just ordinary fats. They help form anti-inflammatory molecules called eicosanoids and resolvins. These messengers may reduce inflammation and cholesterol buildup, theoretically protecting your heart. Thinking of picking up some fish oil? Check out GNC. Hit the link in the description and use code YouTube10 for 10% off. You'll also be supporting the channel. So does fish oil actually work? The VITAL study was published in 2018 in the New England Journal of Medicine and looked at whether fish oil helped those with average risk of cardiovascular disease compared to placebo or a fake pill. After looking at almost 26,000 participants, the study showed that overall fish oil did not make a difference in preventing heart attack or stroke. In addition, the ASCEND trial looked to see if those with diabetes and no cardiovascular disease would benefit from fish oil. In this double-blind, randomized controlled trial of 16,000 patients, fish oil showed no benefit in low cardiac risk diabetics for prevention of heart attack or stroke. That's a major letdown, right? In fact, if you look at the subgroups within the VITAL study, fish oil actually did help a group. But who? For those that had a diet low in fish, fish oil helped reduce heart attacks and stroke. In addition, those with heart failure saw a 31% reduction in cardiovascular events. More recently, a prescription form of EPA, one of the omega-3 fatty acids, called icosapent ethyl, has been released to the market. The REDUCE IT trial found that in 8,000 people with high triglycerides, it cut the risk of death, heart attack, and stroke by 25%. That's no small feat. So clearly there are benefits to omega-3 fatty acids and fish oil, but are there any side effects? In the REDUCE IT trial with icosapent ethyl, the group that received icosapent ethyl had a significantly higher rate of hospitalization for atrial fibrillation, a type of arrhythmia, than the placebo group, though overall the rate was low. This was also seen in a recent study published in the British Medical Journal, where those with no cardiovascular risk factors who took fish oil had a 13% increased risk of atrial fibrillation and 11% increased risk of stroke. So should you take fish oil or just forget it altogether? For most people, eating about 8 ounces of fish a week is better than popping a supplement. Grilled or baked fish is your omega-3 MVP. Personally, I love sea bass, but I don't eat fish often, so I take a supplement once a week. If you've had a heart attack, heart failure, or high triglycerides, fish oil might help. Just talk to your doctor before jumping in, especially because of the risk of arrhythmias. Want to know if milk thistle actually helps your liver? Click this video here. I'm Dr. K from iMedicalSchool. Stay curious, stay healthy. I'll see you next time.